Okay, so we're going to be performing positional release therapy on a few different muscles. The first one is going to be the biceps brachii. So you want to kind of palpate kind of the head of the humerus in here. All right. And you're not applying too much pressure. My hand is just setting here. Bring them up. Elbow flexion, so it assists with the shortening of the biceps brachii. And I'm going to adduct it across his face. And I'm just feeling to see if the muscle is going to release or not. Is it jumping? Sometimes you'll get some light twitches, some larger twitches. And you can kind of change the angle maybe up higher to see if you can get a reaction there. And again, you want them in elbow flexion, so it also assists with shortening the muscle as well. And you just hold this, minute, 2 minutes, kind of just depends on when that muscle decides to relax out. All right. All right, so next one we're going to be doing is we're going to be doing positional release therapy on the QL. So the first thing you're going to have him do, make sure to relax. He's a bigger guy. So you're going to extension, abduction, and then you're going to have them side bend. You can side bend for me. Good job. And then, again, you're not pushing. I'm just laying my hand there. The QL, it's a pretty quick release. So, I mean, pretty much immediately his release actually pretty quick. So, that's it. Again, you want the extension, abduction, and then have them side bend. All right, that's it. All right, so the next positional release therapy we're going to be doing is on the iliacus. So this one you want to make sure you have complete flexion. So for this, have them with your legs, and use the ball. All right, with this one, you also want to have them in some slight external rotation. So just have them kind of there, and then again they opened up the external rotation. And you're not pushing hard in here. There's some internal organs in here that you don't need to be forcing on it. You're just laying your hand in here, palpating to see where the iliac crest is at, and then I know where the embellus is at, and I'll kind of just position myself right in there, and I'm just feeling to see if it's jumping or releasing. Again, the thing is having complete flexion, hip flexion, with some external rotation. And that will help shorten the muscle and then let it release. All right, that's it. All right, so now the next stage we're going to be doing mobilization with movement. So an MWM. And the first one we're doing is knee flexion. So you're on to belt. You're on your butt. And you want to get right at the joint line so you can stabilize the knee. And as they flex the knee, they're going to basically just slide the heel across the table. So I'm going to make sure again that I'm like close to the joint as I possibly can get. Go ahead, Jacob. And you're going to tell me, does this feel better? Does it feel worse? How's that feel, Jacob?
Good.
That's good. All right, so in the case that they say he didn't like this, it didn't feel good, I'm going to swap. I'm going to go superior. Again, applying stabilization of the joint close to it. Go ahead and repeat it, Jacob. All right. Again, if that makes you feel better, feel worse, you're going to do 3 sets of 10 of this. When you do identify what makes it feel better, if that was the strap above the knee, then we'll do that for 3 sets of 10. And again, it should follow within the pill status and make it better immediately. All right. So this one's going to be NWM, mobilization with the movement for PIP of the index finger. So basically, make sure you're stabilizing the distal part of below the joint. I'm just going to, hey, does this make it feel better? Does it make it feel worse? Just kind of see what his movement is. Again, the sooner you do this after, like if they've jammed their finger, the sooner the better, so you avoid doing it before the swelling and stuff takes place. So basic, see how he's doing here. And then I'm going to stabilize it and very much do the opposing forces just a little bit. Ask him, does that feel better? Make it feel worse? If he says, oh, I don't like that, it hurts, makes it feel worse, I'll swap. I'm going to stabilize it here, and I'll just basically flop the opposing stresses that I had before. He's like, oh, that feels good. Okay. And then I'll add a rotation to it. And again, it's gonna be like this. He can tell me yes or no, I don't like that. And I can go the other way. So again, you just want to do this 3 sets of 10. The most important thing is the sooner the better, so you can avoid all the swelling.